Delirium is one of the most feared conditions within the geriatric medicine because it can precipitate dementia or make the existing dementia symptoms much worse. There is no treatment for delirium. The one thing we can do is to prevent. How can we prevent the delirium or acute brain failure? Hello, my name is Dr. Elena Mucci. I am consultant geriatrician and dementia specialist. I am honorary consultant lecturer for Brighton Sussex Medical School. So, what can we do to prevent delirium? First, let's discuss the conditions which can precipitate the delirium. And the most common ones are which put your mom or dad or grandparents at risk: infections, change in medications, change of environment. Just bringing your loved one from that nursing home environment into acute hospital bed can make them more confused. And remember, delirium is acute confusional state. All these situations will put an extra pressure on the brain of that individual, and the bucket might overflow and the acute confusion sets in. Of course, as we grow older, it is inevitable that we will be exposed to either infections or viruses, have medications, have changes in our medications. So this is just a fact of life. So one thing you can do to prevent delirium is to create enough physiological reserves in the brain. So if we do develop these conditions, then we have enough reserves in the brain to deal with that condition. So, how to do that? There are three factors you need to remember about in terms of reducing delirium risk in your older relatives. Number one, make sure that they reduce the alcohol intake. The amount of alcohol they were drinking as younger people, even though it might have been normal for them back then, it's too much now because their elderly liver is not as strong to metabolize that amount of alcohol. So inevitably they will be accumulating their alcohol and it will be damaging their brain over the years in older life. Number two, regular medication reviews. The medicines which they were started on in their 50s and 60s might now be too strong for them now that they're in their 80s and 90s. The medications should be reviewed every 6 months, and the medications which are no longer indicated or do not align with their goals of care should be discontinued. And number three is avoiding hospital admissions. From my experience, the hospital environment is a big risk factor in terms of precipitating delirium and often worsening dementia. So a lot of these infections can be treated in the community, and if you can pull together as a family to support your older relative at home as they're being treated through those 5-7 days of infection, you are very likely to prevent the onset of delirium. I hope you found this useful. Please leave your comments and we can continue the conversation in the comment section. Please sign to my YouTube channel and we will continue the conversation about improving the care of our older adults, and I will give you many tips how to help you with the care of your older relative. Thank you.